Hello and welcome. Thank you for joining us virtually for a press briefing. My name is Anna Antala. I'm a public health nurse and emergency preparedness coordinator for Itasca County. Itasca County is hosting press briefings to highlight themes emerging in our bid to COVID-19 or frequently asked questions posed by our community members. We have been providing twice weekly written updates for the media through the month of June. Beginning in July, we will shift to a bi-weekly schedule and are scheduled for Thursday, July 9th and Thursday, July 23rd at 10 a.m. for virtual press briefings. Today, we will focus on Itasca County's economy and employment. There are 5 social determinants of health as defined by Healthy People. These include economic stability, education, health and health care, neighborhood and built environment, and social and community context. According to the University of Wisconsin Population Health Institute, social and economic factors such as income, education, employment, community safety, and social supports are the largest contributor, about 40%, to how well and how long we live. These factors affect our ability to make healthy choices, afford medical care and housing, manage stress, and more. COVID-19 has had a dramatic impact on Itasca area social and economic conditions, particularly impacting those working and employing others in the hospitality and mining industries. The County Health Ranking Report for Itasca County, which was produced prior to COVID-19, provides a window into strengths such as clinical care and stresses such as social and economic factors as Itasca area stakeholders take action toward recovery. This full report can be found online at www.countyhealthrankings.org. Today, we are joined by Tamara Lowney, President and CEO of Itasca Economic Development Corporation, Carson Gorky, Northeast Regional Analyst at the Minnesota Department of Employment and Economic Development, also known as DEED, Amanda Voller, Career Counselor at the Northeast Minnesota Office of Job Training, and Todd Christensen, Director of Finance at Grand Itasca Clinic and Hospital. Also available for the question and answer portion of this briefing is Jean McDonald, President and CEO of Grand Itasca Clinic and Hospital. We are joined today by our local and regional media. After our speakers, please submit questions via the chat function. We ask that you preface your questions with your name and the media organization you represent, and our panel will respond to the questions that pertain to their organization. Before we move to our speakers, I'll provide an update on COVID-19 numbers in Itasca. Currently, we have 65 laboratory confirmed positive COVID-19 cases in Itasca at the time of this briefing. We have reported the positive cases as soon as we learn of them to stay ahead of the numbers for you as the community, with the goal of providing as much updated information as possible. Infections are linked to multiple sources, some of these cases being of an unknown source or community spread. We have had 12 deaths in Itasca County from COVID-19. We continue to work with the community and our partners to practice safety measures of encouraging masking, washing hands with soap and water, covering coughs and sneezes, staying home when sick, and practicing social distancing to help slow the spread of COVID-19. Public health staff continue to respond to questions via the Itasca County COVID-19 information line, and that number is 218-327-6784. Staff are responding to messages Monday through Friday, 8 a.m. to 4:30 p.m. I would now like to introduce Tamara Lowney, President and CEO of Itasca Economic Development Corporation.
There you go. Thank you. I really appreciate that. IEDC, or Itasca Economic Development Corporation, has been very busy during the COVID-19 crisis. We've been working with many unique business clients here in Itasca County, as well as some border communities that we work with through some partnerships. Itasca Economic Development has had the fortune of working closely with the Blandon Foundation to raise $800,000 in funds to support our small businesses through a small business development loan program. To date, we have effectively distributed all of those funds, and we still have remaining applicants. So it's really important to consider that telling factor that there are still a lot of businesses that are struggling, even as we have reopened and there are people out shopping and working within these environments. People are obviously not comfortable, and they're certainly not going back to business as usual. So we continue to encourage you to look at ways and options you can support your local businesses that may be within your own comfort level to help them with their revenues and drive their sales. There's a lot of challenges that those businesses are facing, and we're fortunate to have Foundation as well as the Iron Range Rehabilitation and Resources Center. IADC is currently applying for additional funds for our loan program so we can get to the remainder of our applicants. We are also really looking closely at the work that's being done at a location in Big Fork. We've unfortunately had a COVID-19 casualty in that the home company based in Canada unfortunately has had a huge hit by the aviation sector losses during the COVID-19 crisis. So their intention is to close the Big Fork facility and move the production of the items made at that plant to Montreal, Canada. And so through this process, we've been working closely with the plant ownership as well as local and regional economic development partners to bring in either new business for that facility to keep them with the existing company in place, or to bring in a new company to help continue to retain the workforce at that location. And that is 60 jobs at the Big Fork location. If you're familiar with the Big Fork area, the town has less than 500 people in it, and this is the largest private business there. So it is really critical to help support that business and those workforce as we move forward. So these are just a few of the examples of some of the hard hit pieces throughout Itasca County. And we're fortunate today to have some of our representatives from both DEED and the Northeast Office of Job Training to share some of the stats on unemployment, and certainly looking at hard hit industry sectors like tourism, as well as the impact that we're going to see on loggers in the coming days as they're impacted by the closing of the Verso paper mill in Duluth. So those are just a few insights, and I'm certainly open for questions as we wrap up the conversation today.
Thank you, Tamara. I'd now like to introduce Carson Gorky from DEED.
Yes, thank you for the opportunity to join today and to share some facts and data on unemployment in the region. So I'm here to provide just a little bit of a wider background view on the situation in terms of employment and unemployment. For the state, from April into May, the unemployment rate rose from 8.7 to 9.9 seasonally adjusted. Locally in Itasca County, the unemployment significantly higher at 11.6% in April, before falling a few points to 11.3%, but still remaining quite a bit higher than the state rate. For reference, the Northeast region, which includes 7 counties, was at 11.4 in May. And these are unemployment rates, the highest we've seen since the Great Recession. And there's reason to believe that the true unemployment number is actually higher than this. There's a lot of new unemployment programs, and with that, a lot of new data and classification information to keep track of. So with that, it's been adding a little bit more uncertainty into the unemployment figures. That, coupled with the fast-moving nature of COVID and its impacts, have strained us. So we try to keep in front of that. And one way to do that is to look at unemployment claims. So this is different from the unemployment rate. It is the number of applications for unemployment insurance. And this is something that we've been able to keep track of day to day, week to week, and it gives us a more up-to-date view of unemployment and the impacts locally. In Itasca County, since March 15th, there have been 6,078 unemployment claims. That represents about 27% of the labor force. The number of initial claims actually decreased from April to May, but the number of regular and continuing claims, which is a better indicator staying unemployed, so those are the folks that are applying multiple times for unemployment, remained high. So, for example, in March, there were 913 regular and continuing claims, but in April, there are 3,267, and then in May, that number decreased barely to 3,237. So we'll keep an eye on those regular and continuing claims. In terms of occupations and industries most impacted, as was mentioned earlier, leisure and hospitality is a big one. Food preparation and serving related represented the most or the largest share of unemployment claims in Itasca County, followed by construction and extraction. So that would include a lot of the mining workers, and then sales and related was the third highest share of unemployment claims. Some of the rationale for why it's a little bit higher, the unemployment rate in Itasca and the region, is just the industry mix. Healthcare, for example, has been hit especially hard, retail, leisure and hospitality, mining, and public administration as well are in higher shares locally, and those have been impacted particularly hard by COVID. We at DEED provide a lot of unemployment information, and we are doing our best to keep it as up to date as possible. So we are here as a resource to everybody for any information regarding labor market dynamics. So thank you for the time today, and I'm also happy to answer any questions.
Thank you, Carson. I'd now like to introduce Amanda Baller, Career Counselor at Northeast Minnesota Office of Job Training.
Good morning, everybody. I just wanted to briefly explain a little bit of our services that we provide with the Northeast Minnesota Office of Job Training in our Career Force location. I work out of the Aiken and the Grand Rapids office. And so when people are laid off, they're unemployed, they have a couple options. We really serve anybody that walks through our doors, but we can specifically help them with maybe up-to-date job searching, resume development, mock interviews, and unfortunately, but fortunately, we're able to do a lot of that virtually in this day of age because we're not open to the public quite yet. But we also can help people with maybe upgrading some skills with our talent development program. We could maybe send them to another further training, which could be up to 2 years to maybe gain some different skills, or maybe take their career or their degree a little bit further. And we help cover costs with tuition and books and mileage. We also have what's called the on-the-job training program. And I love this program because a lot of people that are dislocated from their jobs many times want to just get to work. And so this provides an opportunity for that client to get to work in a timely manner. But then we also identify maybe a different type of work or a different career, just different enough that that employer needs to maybe do a little bit more training with that person. And so because that employer is taking on that client, they are getting paid, reimbursed 50% of that client's wage up to 6 months. And so this is a great way for a small business, even a bigger business, to gain a full-time employee, get a little bit of help financially, but then get that customer right back into the workforce. And so there's a couple options for people. I have posted my information in the chat, how to get a hold of me. We have a website, www.nemojt.org, that we can have people go to and fill out online applications, and those online applications can get sent to the counselor that's in that area. So it's nice for people to be able to virtually and computer-wise get on, but once our doors open, we do offer a lot of one-on-one help and services for people too. And
Thank you, Amanda. I'd now like to introduce Todd Christensen, Director of Finance at Grand Itasca Clinic and Hospital.
Thank you for the opportunity to share how this crisis and pandemic has affected us in healthcare. Similar to what everybody else has shared, the effect has been quite large in healthcare organizations, our region, and really across the state and the entire country. We've been hit fairly hard. Our volumes across the entire organization significantly decreased. Elective surgeries, as we all know, were off the table, or elective procedures for almost 2 months. Interestingly, we also saw a decrease in our inpatient volumes, hospital volumes, and emergency department volumes, really as people were continued to be faced with the reality of this crisis. They were cautious about coming in for care. So we obviously, with the decrease in volume, saw a significant decrease in our revenue here. At the highest point, we were looking at about a 40% decrease on a weekly basis in our net revenue. At the same time, we were expected to ramp up and be ready to deal with this crisis. So we had significant increase in costs on our supply side, developing PPE, surge planning, finding new places to potentially house COVID patients. So really, that drove having to furlough several people. So we have had here at Grand Itasca this year about 200 claims of unemployment, which is probably 4 or 5 times what we would normally see. We have been able to bring several folks back as our volumes have been picking up through the month of June. We are, however, cautious as we look to this fall, not knowing if there will be a second surge or a second wave. We're being very thoughtful in how we bring folks back, bringing that back as volumes dictate. But similar to everybody else, and us being, a large employer in town, there's been an impact to several people just through how this has affected healthcare. So I would be happy to answer questions as well at the end of this. Thank you.
Thank you, Todd. I'll move into the question and answer portion of this briefing. And the first is a question for Todd. Kathy from KOZY. So there was a little bit of issue with hearing the audio portion, and she is wanting to know if you have a written piece available of what you just presented.
Yes, I apologize. I guess my microphone is not picking up, but we can certainly send something.
Okay, thank you. Are there any other questions from the media at this time? Feel free to write in the chat box. And Kathy from KOZY, I know some people who are waiting until, quote, it all goes back to normal. What do you say to them? Would any of our panelists like to address that question?
This is Jean from Grand Itasca. And, we've started to see, as Todd mentioned, an increase in folks coming in. And, the reality is that we don't know when things will get back to normal. So we really want to encourage folks, if they need to be seen, to come in. And we feel that we've put protocols and procedures in place to be able to care for folks safely, with screening at the door and separating folks based on symptoms. And, things are going to get back to normal eventually. We have some new normals, I would say. And as people get used to those, wearing masks in the building and, changing visitor policies and so on, we again just really want the community to know that we're here to care for them and that we have procedures in place to do that safely.
Thank you, Jean. Would any of our other panelists like to address Kathy's question?
Sure. This is Tamara Lowney from IADC. I think we hear this a lot in small businesses. In fact, we really think about these small businesses because some of them missed a little bit of the carrot that was dangled earlier when the COVID crisis, the very first beginning pieces that affected their businesses. And so we hear a lot of businesses wondering when they can expect to get their revenues back, when they can expect to get their workforce back. We've heard a lot about the challenges because there are so many benefits out there to being on unemployment right now of bringing workers back, especially into positions where they would be making less than they're making on unemployment. So what we try to talk businesses through is that the probability of having going back to pre-COVID and the day-to-day operations of your business is pretty unlikely at this point at 3 to 6 to even up to 18 months. We know that you need to plan to really think about how you're operating your workforce, how you're working with your clients and customers for the long term, not on the short term. And I think that's a hard thing for people to understand, because even though people have reopened and there's restaurants that we all love going to, people aren't doing as much travel. They're not going and having lunch like they might have with friends in the past. It just hasn't gotten back to that point. Now we feel like eventually we will. Eventually people will start to feel more comfortable about it, but we want our business owners to be planning for that not to happen for quite some time.
Hi, this is Amanda from the Northeast Minnesota Office of Job Training. And I think on our end, we have a lot of people that are, yes, taking advantage of that $600 a week unemployment. But what we try to encourage them to look at is it's not going to last forever. You're paying taxes on that. And so what if you're missing out on a job because you waited? You waited till the unemployment was done. It also provides an opportunity for people that maybe want a career shift, and maybe we have scholarships or trainings to help them do that as well. So just trying to help people with a plan and a backup plan is really, I think, what we're trying to do right now. And my name is Career Counselor, and it really is a lot of counseling through with those clients on what to do to get them back to as normal as they can be.
Thanks, Amanda, and thank you, Tamara. Kathy from KOZY. So the governor designated Minnesota's funds for COVID. Will that help organizations like IEDC? Tamara, would you like to take that question?
Sure. We're really fortunate that we have a great partnership with our county, and Brett Skiles right away reached out to me to talk about how we might benefit using those funds for businesses in Itasca County. And IEDC is leading a group discussion next week to talk about a few options we can propose to our county commissioners so they can understand what types of programming we could potentially use those funds for. So the answer is possibly, we hope so, but we want to be able to present some really solid programs to our county. There's a sense that those funds should probably be used in some sort of grant program. It has to be used to COVID-related items. And so until we receive all the information on the parameters and rules around what it can be used for, it'll be difficult to really shape a strategy. But I can tell you the two pieces we do know is that the county is very eager to utilize those funds for our community and our businesses, and they have to be spent before the end of the year or they have to be given back. So we are working hard, and we've pulled in a lot of community leaders to help us find a great strategy to present to the commissioner. So hopefully within the next week to 10 days, there'll be more information on how we might roll that out in Itasca County. But it will be a benefit here, most certainly.
Thanks, Tamara. Would any of our other panelists like to address that question? Okay, so from the Itasca County Emergency Operations Center, we do plan to start meeting next week to discuss the CARES Act as well. And Caitlin Moffitt from KBJR 6. With the Big Fork facility closing, is that from just COVID-19, and will that impact the small town?
So this is Tamara at IEDC. The Big Fork facility, the communication from the company is that yes, it is directly related to COVID. Aviation sector has a huge impact, and so when your main headquarters facility is heavily weighed in that industry and sector, then they have had a big impact as well. So we do feel like it will have a big impact on Big Fork, which is why we've put so many resources behind this to try to find an option to keep that facility open. As I said earlier, we've been working really hard with the company. They've been a great partner in trying to find them additional products to produce in Big Fork. That's kind of one way we've been directing our resources. And the second is we've been really working hard to recruit a manufacturer to come to that facility to to really utilize the workforce and continue to operate. It's a beautiful building. It's adjacent to the airport, and they have 60 workers that have been, in fact, the tenure at that location is 16 years. So a strong workforce, qualified in assembly and manufacturing, and we think that's going to be a big asset as we try to recruit. Because even though, as mentioned earlier, the unemployment rate is high, in many areas where there's manufacturing, you can see unemployment rates as low as 2% because there's just not enough workforce available for those types of jobs. So we're using and hoping that the workforce piece will be a big seller for the Big Fork facility, but it will absolutely have an impact on the community. Those were good jobs. They were jobs with benefits. And certainly in many cases, those were the people in the households that were holding the benefits, because as you may know, that Big Fork area is heavy in tourism. They're heavy in logging and seasonal workforce. And so these year-round employment positions held the benefits for families in many cases. So yes, we believe it has a big impact, and we've been so lucky to have the support of the state and local government in helping us to find a solution for that location.
Thank you, Tamara. Are there any other questions from our media? Give it a few more seconds here, see if anything comes through. All right, so with that, we will end today's briefing. Thank you so much for joining us, and stay well, everyone.
Thank you.